My name is Michael Liu. I'm the Director of the Maternal and Child Health Bureau at the Health Resources and Services Administration, U.S. Department of Health and Human Services. I was asked to talk about my vision for what we can do as a nation to improve maternal health. But before I do that, let me just take a moment to acknowledge the extraordinary leadership and service of the Coalition for Improving Maternity Services. I was with you in San Diego in 2009. I've known many of you over the years. I've seen firsthand the energy, the passion, the commitment you bring to the work of improving maternal health in our nation. You remind me of what Dr. King said about human progress. He said that human progress is neither automatic nor inevitable. Every step toward the goal of justice requires sacrifice, suffering, and struggle. The tireless exertions and passionate concern of dedicated individuals like yourselves. I'm sorry I can't be there in person this year, but I want to tell you just how much I admire and appreciate all that you do for maternal and child health in our nation. I don't think I need to talk to your group about quality. You've been the champions of quality and safety in maternity services in our nation. But we all know that there's still plenty of room for quality improvement in the care that pregnant women receive in this country. Whether we're talking about developing guidelines and protocols and toolkits and triggers and so forth to assist providers with management of obstetrical complications such as thrombosis and thromboembolism, preeclampsia, and hemorrhage. Or we're talking about upholding the principles of mother-friendly childbirth initiative about the normalcy of birthing process, empowerment, autonomy, do no harm, and responsibility. And we know that better care can lead to better outcomes and lower costs. Just look at what the 13 southern states are now doing around early elective deliveries. With the adoption of a few simple quality improvement measures, these states have been able to significantly reduce their rates of late preterm and early term deliveries, in some cases NICU admissions. Better care, better outcomes, lower costs. Going forward, I'm going to need your leadership and partnership to continue to drive this quality movement in maternity and perinatal services. And let me just say a word about vertical integration or appropriate levels of care. When we talk about perinatal regionalizations these days, most people think of very low birth weight babies being born in hospitals with level 3 or specialized NICUs. Now I'm reminded that when perinatal regionalization started more than 30 years ago, it referred to both maternal as well as neonatal levels of care. Just as high-risk babies ought to be born in hospitals with NICUs that are equipped to care for high-risk babies, high-risk moms ought to be cared for in hospitals that are equipped to care for high-risk moms, and there's some evidence that that might improve outcomes. But appropriate levels of care also means that low-risk moms don't all need to be cared for in a tertiary center, that no woman should be subjected to any unnecessary interventions, and that every woman should be cared for in a system that respects her autonomy and upholds the principles of empowerment, do no harm, and responsibility, and be given a choice of the mother-friendly maternity services that you all champion. I don't need to talk to you about the benefits of breastfeeding, but we've got to do a lot better as a nation in promoting breastfeeding. Cesarean delivery increases the risk of placenta accreta, which in turn increases the risk of postpartum hemorrhage and cesarean hysterectomy, and the rate of cesarean delivery has also been on the rise. Cesarean rate rose by 53% from 1996 to 2007, reaching 32%, the highest rate ever reported in the United States. That is, in 2007, 1 in 3 babies born in the United States were delivered by cesarean. That's 1.3 million cesarean deliveries that year. Now, cesarean has its place, but given the real risks associated with cesarean, it should not be performed without clear maternal, fetal, or obstetrical indications. We've still got a lot of work to do. Going forward, I'm looking forward to our partnership in strengthening prevention and health promotion in maternity services. So in closing, let me just tell you that HRSA, in partnership with many of our federal and state, public and private partners, are planning to launch a major national initiative on maternal health by Mother's Day this year. In the coming months, I will be sharing more specifics with you. It's time that we put the M back in MCH, and going forward, I'm going to need your partnership and your leadership in this endeavor. So on behalf of HRSA and the Maternal and Child Health Bureau, let me tell you again just how much I admire and appreciate all that you do for maternal health, and thank you for your leadership and your service in improving maternity services in our nation.